Hello, it's showtime, and welcome to another episode of Understanding CBD. My name is Stephen Wallman, the owner of Wallman's Apothecary. We do high-end cannabis tinctures, hemp CBD. This is a soft gel. We actually put the tincture in a soft gel capsule. As you can see, we do full cannabinoid terpene reports, QR code to a full lab report. Nobody does that in the hemp CBD industry, so that's what makes us different. But enough about me. Today is a fantastic interview because not only do we have expert pharmacists, we have two expert pharmacists. And our topic is high expectations. And it's not what you think. Cannabis is medicine, and the modern pharmacist's role is what we're going to be talking about. And the driving factor behind all of these videos that I make are really based on one thing. Most people think that when you say cannabis is medicine, it comes with a wink, wink. Like, yeah, we understand cannabis is medicine. And there is nothing wrong with using cannabis recreationally, but there is a tremendous amount of information and history in humans using cannabis as medicines for 10,000 years at least. It's only been the past 75 years or so when cannabis was prohibited. So my grandfather was a pharmacist. He graduated pharmacy school in 1938. Cannabis was off the out of his tool bag at that point. But now it's starting to change. And we have two pharmacists right here. One, I'd like to introduce you to Dr. Joseph Friedman. He's going to start us off. And Joseph, if you didn't see it, it's another video we did a few weeks ago to talk about his professional cannabis dispensary. And he ran his dispensary a little different than most. And I'm going to introduce you to him first. And then we're also going to hear from Dr. Brett Dunham, who is a pharmacist as well. And he actually did his clinical rotations in Joseph's dispensary. So without any further ado, I'd like you to meet Joseph Friedman and Brett Dunham. Welcome to the show, guys.
Thank you, Stephen. And, I've already recommended your CBD product to a couple of patients that were looking for a credible source for good, high quality CBD. And I think, there's you and there's only one other individual that I trust, that has quality CBD, that has all the cannabinoids on the label and everything else that you're doing. So congratulations on that. My name is Joseph Friedman. I'm a pharmacist. I've got a degree in business and owned and operated a cannabis dispensary in Illinois. And what I learned was when I visited Colorado, prior to opening up the dispensary, was how not to do it. I interviewed a lot of, people that own dispensaries, and I just said, okay, there's got to be a better. So what I did is I opened up PDI Medical. We had a very dicey opening at the beginning because people didn't realize we were different. But, one of the big differentiators was the fact that in 2016, in the fall of 2016, we developed relationships with two colleges of pharmacy, Roosevelt University College of Pharmacy and Chicago State University College of Pharmacy. And what I'd like to do is introduce Brett Dunham, who's a doctor of pharmacy, and he was one of my first pharmacy students doing one of his fourth year required APPE, that's Advanced Pharmacy Practice Experience, clinical rotation for 6 weeks for the first time in the nation in a medical cannabis dispensary. Brett.
Hi, guys. Nice to see you guys. Thank you again, Stephen, for having us as well. Joe, always a pleasure to see you. And yes, absolutely. That's why I was here. I remember, Joe, the first day walking into PDI Medical and thinking to myself that this was going to be surely the happiest 6 weeks of my entire pharmacy education. And it did not let down. And it did not, I learned absolutely a ton along the way. But it was a pleasure. So yes, Stephen, thank you for having us. Happy to be here.
Yeah, sure. It's a pleasure. And, when you first thought of your, rotations at a medical cannabis dispensary, before you walked in the door, what were you expecting?
I wasn't really sure. I knew how Illinois had structured the medicinal program. So I knew the requirements for somebody to walk in the door and walk out with cannabis. So, kind of inferring from those requirements, which were very strict and continue to be, somewhat strict, even with the advent of adult use in the state. So I kept an open mind, and it blew me away. It honestly blew me away. It's not that I was expecting, the tie-dye and the bongs, but it blew me away in terms of how much it felt like a medical establishment. You walk in, you speak with a professional, and it was really a great experience. I learned a ton and got to talk to a lot of awesome patients along the way.
Have you been in a dispensary before then?
No, PDI Medical was my first time. Well, at least, behind the counter, in
Behind
Illinois.
the counter. You'd been in one, a dispensary, but just not behind the counter.
I've seen them across the nation in states that have had, longer cannabis cultures than Illinois has, especially with adult use. But Illinois was very unique, and like I said before, very stringent in terms of being able to access for patients to access that as an avenue for care. So very professional overall, and PDI was just the absolute.
You ruined them, Joseph. Yours.
being in the medical background, I think that was the only place that I really would have thrived and been able to share the type of knowledge that I accumulated in pharmacy school, studying to be a pharmacist, and to share that specific type of knowledge with patients. And it's unique, when you say you walk in and you see a bud tender versus, somebody who is medically trained and understands what you're trying to tell them and understands the words you're trying to tell them. There's a difference. And, there's an outlet and there's a place for kind of everything and everything in between. It's kind of a spectrum, right? But a lot of patients seek that end of the spectrum where you can really count on, trained medical professionals to give you an evidence-based advice.
And, I think one of the important things for the audience to realize is that you can't find pharmacists in dispensaries as a general rule. And certainly you can't find pharmacy students doing clinical rotations in a medical cannabis dispensary as a general rule. The pharmacist, if there is a pharmacist in a dispensary, that pharmacist becomes the preceptor. The College of Pharmacy needs to work with that preceptor, and there's a number of things that you have to do as a preceptor in order to accept a pharmacy student from their College of Pharmacy to do a clinical rotation. So if you walk into any cannabis dispensary, in Illinois, you're not going to find, you're not going to find a pharmacist, and you're definitely not going to find a pharmacy student doing a clinical rotation.
Yeah, PDI Medical was the only pharmacist-owned and operated dispensary in the state.
And maybe the only one that I know. I haven't heard of any. There may be some out there. I'm in Maryland, and there's a requirement for a dispensary to have a medical person that is their medical advisor, but they don't have to be in the clinic, in the dispensary, and it's by no means part of the onboarding process. There's a requirement for the dispensaries to report to the state of how many of these consultations occur, and I don't know if there was any in a year, because it's just the way the system is. But it's really fantastic what you gentlemen have done, and I think it is what will be the future as we go through this transition and learning, as people are experiencing cannabis now that they haven't experienced for so long. It might be the cart before the horse in a lot of different ways, but that's what I want to talk to you guys about today, because you are really on the ground with what's going on in the medical field. And, Brett, when you first walked into the dispensary, despite of what you felt before, have your perceptions changed on cannabis being used as a medicinal tool?
Yeah, absolutely. That experience was invaluable because it confirmed and quantified a lot of the ways that I know that cannabis can and has helped people in the past, because in a setting like that, you're challenged to not only have an opinion, but be able to back it up. So you have to know, what little evidence is out there. You have to, kind of really be well-versed in that. And somebody asks you a question, you have to be able to, probably look it up and go find it. But so, yeah, absolutely. I think cannabis in general is old school. I think the new school, it's kind of old school pharmacy. It's like extracting medicine from nature and standardizing it in a way that's repeatable, right? Because it's kind of where a lot of medicine comes from. And I think the future and the more, what expanded my perception of cannabis was the specificity with which we can apply it now. Cannabis is it's everybody is sort of, the entourage effect, right? Well, sometimes you can pick that entourage apart. Sometimes you don't need the whole entourage. So you can pick apart and specify with certain cannabinoids at certain doses for certain reasons. And there have been a ton of interesting products that have, been able to do that and fill a lot of interesting needs for patients with specific wants and desires. So
that's helpful,
really
Brett.
showed me a lot.
Yeah, and not to stop you there, but I think it's worth going into the entourage effect and just diagnose and break down what you said there, because the entourage effect, for those that don't know, is the synergy between all the compounds that you can get from cannabis. And you're mentioning that is, what people look for is that entourage effect, that whole plant medicine, but there's more to it, is what you're saying.
Yeah, cannabis has a very diverse phytochemistry. If you look online, people will be able to give you, or you'll be able to find lots of opinions on lots of different cannabinoids. And that means there's slight chemical variations of either THC or CBD. Those are kind of the two main branches. But there's dozens of analogs and similar compounds that maybe act differently or act differently together. But at the very least, we know they're there, so we should study it more. And I think it leads to, if nothing else, a need for some more concise, study, and definitely an unlimited realm of possibility for people to, throw their hat in that ring and be creative about it too. Cannabis data, I think right now is starting to mature a little bit more. We're starting to see better and better trials. I think there was recently a meta-analysis that came out for inflammatory bowel disease, and it kind of looked at 26 or 29 studies, and overall it said, yeah, this in general shows benefit, but studies like these, which normally is a very high level of evidence, a meta-analysis, right? Studies even like that suffer from a great heterogeneity of outcomes in their constituent studies. So not everybody uses the same ruler to measure the benefit, and not everybody measures benefit the same way. And so to really broadly apply something like that is still a little bit difficult, but it's better than the anecdotal evidence that, historically people have cited. So
yeah,
there's a movement for that. Yeah.
Sorry, I didn't mean to cut you off, but I was going to ask you, what would you consider to be a good source of data? Because, anecdotal evidence, it's kind of word of mouth and it's kind of wishy-washy. And I know you guys as pharmacists don't like those things that aren't very precise. But when you look for a data source, really, what are you looking at? What do you trust?
Well, I like to think that there's a grain of truth in a lot of anecdotes, especially something that's been around for that long. Cannabis, like you said, has been used as medicine or recreation in one way or another for a long time. So I think many of the anecdotes are worth, they're great starting points, if nothing else, and maybe, you rule it out pretty quickly, but maybe it leads to a couple of other questions that, that you can answer. So I think I'm partial to PubMed and all of the sort of, kind of classic literature search, avenues that you would see. But in general, stuff that's peer reviewed and published in a journal is a great place to start. And like I said, you can't really base your opinion on one piece of data that you find. You need to form a constellation of data points to kind of form your opinion. And I think that's a huge part of pharmacy school and kind of medical education these days. And I think that's one of the most important things I learned in pharmacy school is
and just because there's access to data, my the biggest challenge that I see is people try to play pharmacist. They go to PubMed, they read the articles, they don't understand. I'm just speaking for myself and most of the people that I speak with, as far as my clients and customers. We don't understand the information. There's big words that we haven't been trained on understanding. So the context a lot is lost. So the experts are really important in this industry. You can't just go and Google yourself and try to find a solution. You really need to have people that are trained to synthesize the data.
And one of the important things, and I'm going to take something that you said, Brett, is you take someone who has a devastating disease. Let's use cancer, and we had many cancer patients come into PDI Medical, thinking that it was the silver bullet, the holy grail, and it's going to cure their cancer. And I think, and I think that's really, one of the downsides of anecdotal information is because they read it somewhere. And so I think when they come in, what we have to do and what's so important to do, and I'm not sure this is done or even allowed to be done legally, is set expectations. Cannabis, there is some data out there. It has been used in certain types of cancer, but at the same time, you really have to set expectations and say, this is not going to, don't stop your chemotherapy. Don't stop everything that your oncologist is prescribing. Do that, but also listen to a healthcare professional who can give you some information to give you a comfort level in the idea of trying it for, palliative things like sleep and appetite and pain and things like that. And then maybe we'll have a discussion about it, using it as a to kill cancer cells, which is still just, we need research on that.
Joe, I think what you said was very important. People come in with huge expectations, and that piggybacks right off of what you were saying with, access to information doesn't necessarily make everybody for the better, because it is rife for misinterpretation. And Joe, what you said about managing expectations, I think was key. That was one of the most important things I learned. And what I started to do and how I started to act at the pharmacy, setting an expectation with patients, I used to describe it as translating. I used to translate for them, right? Because I was the intermediary between an avenue of healthcare that they were seeking and the reason or the malady, the sickness, why they were there. And so oftentimes it was directly interfaced. There was no medical professional between that to offer those services. So my view was that, especially a first-time consultation, I would sit down with them and I would gauge their level of comfort, because even though they're walking in the door, that's a huge battle for a lot of people, or it was for some of those patients. But even walking in the door, there's still a lot of uncertainty, because those patients may or may not have ever smoked a joint in their entire life, right? And now they have access to unlimited formulations of cannabis, and they're looking at tinctures, and they're looking at pills, and they're looking at dried flower, and they're looking at concentrates in every kind of edible form that you can imagine. And they don't know how to dose it, and they don't know what they're looking for. And so that was one of the most important things I asked them. I said, what do you want this to do for you? And I managed expectations in that way. I said, what do you expect? What do you want? Why are you here? What do you want this to do for you? And in doing so, and in understanding that reason for them sitting across the table from me, I could then translate, because they could tell me, the reasons that they were there, and they can use their diagnosis and they can say those words, and I understand that. And then I have a knowledge of the products, the kinetics of which, the different applications for this, that, and like I was saying earlier, different cannabinoids that, we can try, play around with. And so although it was and continues to be a bit of trial and error, that really helped to both focus, the conversation, focus what you were doing in terms of therapy for them, and to set those expectations. And while I saw personally that it helped greatly, the vast majority of people, that walked through the door and sat down at a table with me, there were some that didn't. And that's normal, right? Everything in medicine, is risk versus benefit. And, sometimes it, doesn't work for some people.
And, I think one of the key things, Brett, that you also did, and I always did, was, we would look at, we would have patients fill out a form that was similar to the form they fill out when they see a doctor for the first time. And, one of the items in that form, aside from, age and weight and eating habits and sleep and exercise, was the drugs that they were on. And there are drug interactions with cannabis. I mean, a lot of them aren't real severe, but some of them are significant. And plus there's drug interactions with sometimes the drugs that they were taking, serotonin syndrome. I don't know how many times you saw that, causing the aches and the pains and the discomfort that they were experiencing from two drugs that two different doctors had prescribed that didn't know that this patient was on.
Yeah, Joe, we were doing medication reconciliation before it was cool. We were doing that in a setting where and that really goes to show you how important, knowing all of the variables in this equation is. And nowhere else are you going to get that type of expertise other than in a setting that allowed it to prosper like this. So I remember contacting physicians, of course, at the with the permission of those patients, and they were thrilled because oftentimes there were elementary, very, very easy to spot either overprescription or polypharmacy, or it's like, why do you have this? Oh, I don't know, I've had it forever. It's like, well, do you still need it? And so we were able to get rid of a lot of stuff, and whether or not that contributed to the overall care of that patient, kind of it doesn't really matter. They were there to be better, and they were at the end of the day, and it was really nice to be able to contribute in that setting for those people too, because and the truth be told, I think our bread and butter at that dispensary, and Joe, please correct me if I'm wrong, but the bread and butter at that dispensary was not your average, paradigm of a dispensary goer, young and healthy and there for recreation. It was, your grandma, your grandpa, people who had been through the medical ringer, and they had been to this specialist and that specialist with varying degrees of success. And now we're ready for something, quote unquote, alternative.
And many had been to other dispensaries too.
Yes, oftentimes that as well. And we ruined them too, Joe. So they were really, once they came there, that was it. That was the standard.
And that really blows my mind that someone's going to walk into a dispensary and here they come with a pharmacist who's able to reconcile their pharmaceuticals that can recognize problems and solve them before even, cannabis is even on the table. You're just taking the time to look and talk to the patient and see what's going on, reconciling between, different prescriptions. I think that's amazing what you guys do there. Can you share any success stories where cannabis has made a difference in a medical condition specifically? Is there anything that you can share?
Go ahead, Brett.
Yeah, I'm sure you have unlimited stories when it comes to that, Joe. But there was one in particular that I can think of. Young guy around my age at the time, suffering from some pretty severe inflammatory bowel disease. Actually, that's why I'm interested in that data, and I mentioned it earlier. And he he had all the classic symptoms. I think it was Crohn's disease or an ulcerative colitis, something along those lines. And he was losing weight, no appetite. In addition to all the inflammatory processes that were happening as the root cause of the disease. So in addition to, the other therapy that he was receiving from his gastroenterologist, he felt that cannabis was a good addition to that. And I agreed, absolutely. So we sat down and we really kind of very thoughtfully planned it out. And we said, okay, well, when you have inflammatory bowel disease, what's the best method of administration? Well, the kinetics of this, when you try to absorb it from your GI tract, which is inflamed, it's variable. There's two, we don't know. It's not going to be great though. And so are you going to get the best bang for your buck? Because, we had to budget at the time too. Cannabis is not inexpensive, especially to the quality that is present in Illinois. So it was an overall success story because he came back time and time again, and we kind of fine tuned it. We dialed in, and some things worked and some things didn't. But we had enough of the successes to really hone in on a successful overall therapy for him, which included transdermal stuff, as well as tinctures, some sublingual things to kind of bypass that GI metabolism. But it was a very thoughtful conversation that we had, and he was a great patient, and it's really stuck with me.
And Brett, I think if this is the patient that I'm thinking of, I think the first time he came in with his father.
Yeah, I think we are thinking about the same guy, Joe. We'll have to reminisce about that, offline.
But his father was very much against it and didn't think that it was going to be beneficial for his son, who he was very concerned about. So we had to convince his father first that, yeah, it's okay. Your son is under good care here with, healthcare professionals, and we're going to make sure that if there's a benefit here, we're gonna try to get there.
Yeah, go ahead.
No, I was just going to say that there is a delicate balance. You're mentioning a patient coming in with his father who's not on board or has preconceived notions, and it's a delicate balance between the therapeutic benefits and the recreational benefits. How do you guys navigate that just completely polarizing sides of people just really not understanding?
Yeah, I think that you have to embrace the recreation to kind of legitimize the medicine. So, for example, California has a very long cannabis culture, right? It has a very long cannabis culture, and historically, it always was medical. And it used to be the kind of thing where you go to the Kush doctor on Venice Beach and you're like, yeah, I have some headaches. And, you walk out with a prescription, this, that, and the other. And it was accepted, but at its root, it was truly an abuse of a supposedly medical system. So I think it undermined the legitimacy of people like this guy and like this kid, or not kid, but this guy and his father. And, had they walked into the Kush doctor, you wouldn't have changed you wouldn't have changed his mind, but they walked into PDI Medical and they sat down with medical professionals, and, we spoke a different language. And like I said, we interpreted for them. So I think, you have to embrace the recreation. People have been doing it for no reason other than to, feel better or relax, whatever, recreationally for a long time. It's not going to stop anytime soon. So you have to embrace the recreation to kind of legitimize the medicine, and then you can really get very specific and study it quite in an unlimited manner.
Well, integrating this into the traditional medical system is, we're in the process of it now. What do you see as some of the big hurdles that we need to overcome in the coming years? And that could be either one of you guys, both of them. I'd love to hear what you have to say about that.
Yeah, one thing comes to mind, Joe. You want to go ahead?
No, go ahead. And I've got some things too, but go ahead, Brett.
Yeah, I think formulation is going to be a significant hurdle for cannabinoid-based pharmacotherapy in the future. There's only a couple of FDA-approved cannabinoids on the prescription market, most of which are synthetic. There's one drug called Epidiolex that is actually sourced from cannabis sativa. And it's the only, plant. It is CBD, but it's very concentrated and in a very, very pure and specific, in manner. But it is the only cannabinoid on the market that is plant based. It is extracted from a plant as opposed to being synthesized. So I think formulations and kind of that is going to be tricky because as of the moment, it's still scheduled in a manner that sort of prohibits that. So you have Spider-Man kind of like, who are they pointing at? Is it legal? Is it not legal? So we're going to have to kind of reconcile those issues before we can make some really meaningful strides in expanding those avenues, I think.
Yeah, and one of the things, and I think maybe I mentioned this on the last podcast, is your general run-of-the-mill pharmaceutical company is used to developing single molecule drug entities, and here and you take a look at what's on the market. They're single drug, and they go through the clinical trials and they go through the testing and everything else. You take a look at the cannabis plant, the entourage effect. You've got hundreds of molecules. And I think it's going to be very hard for a pharmaceutical manufacturer to go ahead and put it through the rigor of a study and clinical evidential testing to see exactly how this works. I think it's really going to be a hodgepodge. And I think that's why the pharmaceutical industry has a lot of money and lobbying to prevent legalization. because they know they're going to lose a lot of money, and they've already lost a lot of money to cannabis dispensaries that are treating a lot of those patients that used to be on benzos and opioids and sleeping pills and antidepressants and things like that cannabis is now addressing.
Well, it's these existing industries. You have the pharmaceutical industry, you have the alcohol industry, you have the tobacco industry. All three of these have a concern for what impact cannabis will have on their clients, their customers, their revenue streams. There's no question about it. And I'm sure they're all jockeying for position to find their way. How are they going to enter? And I mean, you guys know the power in the pharmaceutical industry, and there's no question that they'll be able to find a way. And it's interesting to see the way that this will integrate, because you have the whole plant. They'll never. You're not going to just get a prescription of. I mean, what are some of the names of these cannabis strains? They're not going to say go get. Girl Scout cookies. You're not going to get a prescription for Girl Scout cookies. Or diesel cake, or birthday cake, whatever these names are. They'll have to be formulated somehow. But Brett, you brought up an interesting point, which is actually both of you, the single molecule pharmacy, and then also the difference between synthesized cannabinoids and the actual plant cannabinoids. Just as a non-pharmacist, does it matter? I mean, if you have a CBD molecule that's been made in a lab, or a THC molecule for that being, versus the same molecule that's been extracted from a plant, is there a difference? Does it matter?
Well, if you're speaking in terms of one drug or one cannabinoid interacting with one receptor, or any drug interacting with its target, does that protein that it's locking onto know if it is a synthetic or a naturally derived version? Not necessarily. I think that there are definitely differences. They're synthetic because they need to be specific, right? It's like Joe was saying, you can't, FDA labeled indications and that sort of stuff. You don't get with an entourage effect polypharmacy product.
And consistent as well.
Right. So, and that's part of the reason Epidiolex is so unique. It's very pure, but very concentrated CBD that was studied in seizure disorders, very specific seizure disorders. But I think it's tough to say. The short of it is maybe not. Certainly, when you have a single cannabinoid, you totally lose the entourage effect, that we'd been referring to beforehand. But it is an interesting question. There's only a handful on the market right now, and while it may not be the most ideal situation, I think it does force the existence of some data. And undoubtedly, when you go measuring things, you wind up with hopefully an answer to what you were measuring, but also probably some more questions that you developed along the way. So if nothing else, I think it's okay that we have kind of the stock of that evidence, that's going to blossom and then maybe provide some other, it's kind of like a train, it's hard to stop now. The interest is there on all levels. I think the interest is there not only from the patient perspective, it's like you were saying, Joe, somebody who might, reassess their situation and say, hey, maybe I'm over medicated. I can, ask about this or, consult this person to replace some of these. Everything in medicine is risk versus benefit, right? When you have a headache and you take Tylenol, there is risk in that, right? We know that it can derange some of your liver enzymes. It can be hard. It can be hepatotoxic. So, and there are a certain number of people who injure themselves every year from Tylenol toxicity. So everything in medicine is risk benefit. In the case of the Tylenol, 99% of the time, the risk is so far outweighed by the benefit that it's an easy decision, right? And so I would like cannabis, and I think people are starting to think of cannabis sort of in that way. what is the risk versus the benefit? Well, if the benefit is, I feel a little bit better for whatever reason, we're like, okay, well, that's kind of the point of any healthcare that I was seeking. So what is the risk? And they go looking on that side, and you wind up finding very little. And so a lot of people are reconsidering and kind of learning more about that, and reconsidering kind of that overall picture of what it means to have healthcare for themselves.
And one thing that we did when we had these pharmacy students come in is I would send them an email that was actually 2 years in the making, that contained a lot of links to information from around the world about cannabis, because I wanted them to really hit the ground on day one for their 6-week clinical rotation. And then once they were on board, we would go into a room with a patient, and the pharmacy student would observe myself or one of the other pharmacists who was familiar with this to give a consultation. And then hopefully within 2 to 3 weeks we would have that pharmacy student solo with the patient. Brett, I mean, he sounds great, and he was soloing within 1 week. I mean, I had that level of confidence in his knowledge and his ability to sit across the table from a patient and really deliver a very high-end consultation that included everything that we were all about.
I appreciate that praise, Joe. It truly was a fantastic learning experience for me. I learned. I came out of that rotation having learned so much about not only the medicine behind it, but kind of the overall business and how it applies and fits into, and the evolution thereof. Healthcare, cannabis, and healthcare.
And I know, Brett, you continue to do clinical rotations. Why don't you tell? I mean, you told me a story. I think the audience would be interested in hearing this, when you were at a hospital. And
yeah, it was one of the. So I did all of my pharmacy education around Chicago, and your fourth year, basically your fourth year of pharmacy school, you were out on rotation. So you're out of the classroom, you're just out on rotation, and you do a bunch of those in a row. And Joe's was actually, that was my second one, I think. Yeah, it was number 2 for me. So it was really early. So, when you go on to the next ones, everybody inevitably says, hey, where were you before? And it was a large academic teaching institution in Chicago. There's a couple. But no, it was fantastic. I got asked by a preceptor, where are you coming from? And they expected me to say something like Walgreens or some other typical answer. And I think this is one, when I said the cannabis dispensary, it was an answer that they hadn't heard before, and so it drew a lot of attention. And it truly, when I spoke about it the way that I'm speaking about it to you guys now, and I really was able to explain the benefit, and even to another, or not another, because at the time I was a student, but even to a pharmacist who doesn't know, it was very cool. It was very cool. But they were very, very surprised. So I was able to build a really good rapport with that preceptor, and it's led to a lot of great conversations for me. It's something on my CV that no matter where I go, somebody usually asks a question. Like, oh, this is not something that you see a lot. Can you tell me a little bit about this? Just if for no other reason other than their sheer curiosity. And this, we ended up, actually, it was a pediatric rotation. So I practiced in pediatrics for 5 years after residency, but this was as in school. So the rotation after that one, or actually, no, that was at the oncology center. I think it was at the oncology portion of the other hospital. But yeah, it was a very unique experience that kind of, I got some funny looks at first, but it was something that was not entirely foreign to a lot of people too. At one point or another, you, as studying to be a pharmacist, you kind of come across it once or twice. And like I said, there are FDA labeled drugs or FDA approved drugs that are cannabinoids. You kind of have to know about it a little bit. And I think everybody is curious, regardless of their level of experience with cannabis in the past. I think everybody's at least a little bit curious. And so I think that's one of those things that a lot of these relationships kind of help to fix and helps to address as well, kind of like a literacy, like a cannabis literacy amongst healthcare professionals. I think that as it proliferates, medical professionals kind of across the board need to be familiar with it. And if they aren't, they got to have a friend who is. Everybody collaborates quite a bit. But nowadays, it's easier and easier, hopefully, with those relationships between dispensaries or medical, whatever aspect, medical cannabis in general, and education, you kind of help to fill that gap and kind of improve the cannabis literacy amongst your up and coming professionals. So I expect in the near future to hopefully see a lot more knowledge and kind of interest as well in cannabis in general. So I think it's here to stay. I don't think it's going anywhere. Like I said, it's been around for a long time, and I think it will continue to be.
Yeah, I was interviewing Dr. Benjamin Kaplan from Boston. He's done a lot of clinical work. He has a new book coming out about cannabis, a doctor-approved book. And in his mind, he thinks if a practicing physician is not aware of cannabis, they should just refer them to someone, just like the referral system today. When they don't, they don't do everything. They can prescribe something, but they refer to a specialist.
Yeah, absolutely, totally appropriate.
And I had an experience just earlier today where I was speaking to a patient who was referred to me by someone that I knew. He's in Georgia, and there's no cannabis program in Georgia. There's just Delta 8 and Delta 8 stores and vape stores and so forth. And but he had connections in Illinois, and he can get product from Illinois. And what I always do is when you walk into a dispensary, I mean, there's very nice people that work in these dispensaries. They're given a day and a half of training, and then they're set. And some of them have experience with cannabis, and so they know a thing or two. But they are required by the company that owns them not to really get into a lot of detail because of the legalities. So what I do in these conversations is I say, I really want you to walk away from this conversation and take notes with what exactly you should ask for. Certainly listen to the bud tender, but here's what you should ask for, and don't take their advice, because the advice I'm giving you is probably a little bit better than someone who smokes some pot and works for an adult use dispensary and for $13 or $15 an hour.
Yeah, day and night. I had one question, Brett. Did you have any, and Joseph too, did you have any pediatric cases that came into the dispensary?
Yeah. Oh yeah, definitely. In general, I would say that children who are treated with cannabinoids, because again of the decision between risk versus benefit, the kids that you go to cannabinoids with tend to be some of the most refractory patients. So most often than not, and specifically how CBD was studied, in the product that I mentioned earlier, was for Dravet syndrome and related very incapacitating seizure disorders, right? So they tend to be refractory and therefore a polypharmaceutical minefield sometimes, because they are on XYZ drugs, and in general anti-epileptic drugs are kind of nightmares to dose, especially altogether. So this, I remember that was before actually that product existed, and so they were on the right. They knew, there were patients in there, and I remember because it was a huge legal issue. Obviously they can't walk in the door themselves, so they have a caretaker who's also registered. And then the conversations that we have, there were certain restrictions on what they were and were not allowed to, utilize for that, whatever therapy you decided for them. And it was interesting. Those were very high risk, high reward type situations where you really need to be very strategic. And it's something that in that setting, you can't necessarily do alone. I did talk with some of those people's or some of those children's physicians. And I said, if I had a question, that's honestly, it was my mentality. Like, we're on the same team. right? I don't want to mess up anything that you've been doing. They know this patient, for a long time. They've treated them, at a very high level for a while. So I want to work with that. And I think that in being able to speak to some of them, it was interesting because actually always in my experience, the physicians knew that they were there. And while they may or may not have condoned it themselves, they didn't see any detriment, right? So even that potential for benefit in these patients was worth, looking at, because again, there was, there is little risk, or the dichotomy, it's a little more heavily weighted. So yeah, those were high stakes cases. And Joe, I remember, sitting down on the same side of the table with you across from some pretty complicated cases, some pretty medically complex. And you know what, when the children that come in that present with those types of diseases, 99% of the time, their parents are very, very medically literate themselves. Mm-hmm. They're strategic. They have schedules printed out. They have, dosages memorized. And consequently, they've been able to kind of apply those skills that they've learned, that they've acquired, to the cannabis world too. So we tended to have some pretty high level conversations with them. They tended to be overall a little more knowledgeable at baseline, which is good.
One of the earlier pediatric patients that we had, the caregivers are always their parents. This is before we really had a lot of different variety of products. Mm-hmm. And, we had flower. And in Illinois, if you're under 18 and you're a patient and you have a parent caregiver, you cannot purchase flower. It was just a rule that, if a cannabis dispensary sold flower to a minor, they would get. So what happened was we had these products, these devices in the dispensary. One was called an easy butter maker. And early on, when we only had flower, I didn't want to send them away. So I sold them flower, and I explained to the parents, and I showed them exactly how to use this machine, how to measure out the amount of flour, add oil, and do all the calculations to give that child the right dose of CBD, mostly with maybe a little bit of THC if that was needed. And what was interesting was that child did actually wound up doing well. And we had an inspector come in. We had 4 inspectors the first year we were open. I worked in a compounding pharmacy prior to opening the dispensary. I saw an inspector once, like in the 2 years I was there. And I remember that inspector coming in and said, "Did you sell any flower to a minor?" And I had to say, "Well, yeah." And, they looked at we had the system, and they can actually see what we did. And I said, and then I explained why, because in those early days, that's all we had. We still got fined like $1,500, for doing that. And so that's how goofy the rules were, that we couldn't help these children early on.
Yeah, it's an evolution, and it's
you're fine for it.
Yeah, that's just ridiculous. As I'm thinking about you guys doing the work that you were doing there at the dispensary, which is truly amazing, I really would love to see more of this, and I think it will. Hopefully, when you're going through a patient, you're reviewing their meds, their condition, and it requires a conversation with the doctor, their doctor, specialist, whatever. You ever have any bad pushback from any of them? Like, no, or were they mostly amenable to what you were recommending?
Yeah, overall, that paradigm, like, imagine you're an attending physician and you get some student calling you, right? So
yeah, hey, I'm calling from the dispensary.
Yeah, and it's just, you pick up that phone call and you're like, wait, what? So there's that initially to overcome. But again, if we speak this kind of the same sort of language, and we're trying to treat this patient at a very high level. So by that time, I'd done my homework. I knew a lot of the history. And you do all the stuff that you learn to as a clinical pharmacist. You get to know that patient in the relevant ways. Mm-hmm. So by the time you have that conversation, hopefully after a minute or so, which is key, they start taking you a little more seriously. So overall, no, I will say it was never really negative. Maybe dismissive at first, but nothing super unexpected. And there were a few that were surprisingly accessible and enthusiastic. So it was nice to see that trend as well.
And physicians couldn't, when they saw a patient, couldn't send a patient to a specific dispensary, but we had one physician who would say, okay, well, and she would, certify a patient for medical cannabis and get their card. And she would say, well, you can go to this dispensary or this dispensary, or this one has pharmacists there, so you might want to go there. And so she got through, that whole process of getting in trouble with the state by recommending a specific. So as soon as that patient heard, oh, there's pharmacists at this one, and there was maybe a wink, wink, that's how that worked.
Yeah, that's really amazing. I know we got to get going here. I do have one other question, and it's regarding THC limits. Nowadays, people shop at a dispensary. They're going in and they're saying, I want the highest terpene percentage a lot of times, or they're looking for specific terpenes, but then how much THC is in it? And this is a question to both of you. And medicinally, how important is that high THC limit? Is there any context you can provide on the value or importance of that high THC?
Yeah, it's again, I'm going to cite some of that inflammatory bowel disease stuff. The benefit that they concluded was derived from THC content, and although the benefit overall was a reduction in symptoms and an overall improvement in quality of life. And as far as the people who come in that say, hey, I need the highest THC possible, some people just require a higher dose. And that's what it comes down to. So while it's okay, you can always try to steer people towards whatever might be the best product for them. And sometimes it just happens to be the most concentrated. Joe, I remember when we were in PDI, we got a shipment, and it was the first flower that really anybody had seen in the state that hit 30% total cannabinoid weight, or 30, it was over 30% cannabinoids by weight. It was the first time that threshold had been cracked, and there was a frenzy for it. It was crazy. It was gone. It barely hit the shelf and it was gone. But nowadays, I will say, overall, they seeing 30% is not uncommon, especially in Illinois. It's crazy.
And with
proliferation of this.
With cancer patients, if they chose to go the route of looking at THC and CBD to help them, and again, this was with a lot of expectation setting and things like that, we had a protocol for flooding their system with THC and CBD cannabinoids over a 90-day period, and so many grams in that 90-day period, to flood their system with cannabinoids to try to help them with their cancer condition. And none of this is really scientific, but it was based on information that we were able to get from this one doctor in Denver, Dr. Joe Goldrich, who I think is now retired, but we did some consultations with him, and he had protocols, and so we just adapted those protocols for our cancer patients that were amendable to using cannabis to try to help fight their cancer.
Wow, that's great. Well, guys, I appreciate the conversation today, just giving us a little glimpse into what it's like in a professionally run pharmacy with cannabis in it. And you guys are really pioneers in what you're doing. And I want to thank you again. Is there anything else that you'd like to mention to our audience before we sign off here?
No, it was a pleasure. I really appreciate having this conversation. I hope that, I hope it kind of enlightens some people, and at least, it sparks a couple of questions. I think that the more people learn, and like I said, that overall kind of cannabis literacy, specifically in healthcare, I think that it's very valuable. It's a very high yield area to be proficient in. So hopefully we can spark some interest and, get people reading.
And I think, based on what Brett just said, I think everyone that walks into a dispensary, if they are a patient, if they're looking for something that's based on a condition they have, do the research, talk to a professional. I mean, they're out there.
Bring a friend.
Yeah. And instead of just walking in and just, asking the person in the dispensary what they suggest, because you're always going to be better served by doing some prior research before you walk in.
Yeah, and if you're listening to this, you can put a message in the comments. We do work with a lot of referring physicians that are trained in cannabis as medicine. So if you don't have someone that you know, feel free to reach out, put a comment, email us, call us. We're happy to connect you with someone, or at least give you some choices of people to talk to. And with that, any other comments, guys? I really appreciate Joseph for all the work you do, and Brett also. I'm glad you guys met back in your residency, and we're able to really really change what you're doing, and hopefully more professionals, healthcare professionals, take the initiative to learn about cannabis. I guess at some point it will be mandated that you have to have a certain amount of credit hours of cannabis medicine. Hopefully, it's not currently, I don't believe, but it might take that in order for people to, get out there and learn about it.
Thank you, Stephen.
Thank you, guys. Have a great night.